Tax season is just 2 weeks away. The IRS announced today it will begin accepting and processing 2021 taxes on January 24th for individual returns. We've seen so many delays over the last few years when it comes to processing and refunds, but the IRS says there are some things you can do to ensure your tax return doesn't get hung up this year. Here are the 3 most important. 1, file electronically. We know paper returns usually take weeks and sometimes months longer to process. 2, if you are owed a refund, make sure the IRS has your correct direct deposit information. And 3, make sure your return is accurate. Filing mistakes are easy to make, and filing your return quickly just to get it out of the way, even though it's inaccurate, is a mistake, especially if you received a stimulus payment or any of the monthly child tax credit payments. If you received either of those types of payments, the IRS says you need to either wait for those 2 letters from the IRS to show up to your house telling you how much the IRS thinks it paid you, or you can go to irs.gov and check your account to see that same information. That way, you'll be able to accurately calculate your refund or your payment. The IRS says, regardless of when you file your 2021 return, if you are owed an earned income tax credit or additional child tax credit, by law, the IRS cannot issue any refunds before mid-February. For everyone else, the IRS says, as they have for years, they are anticipating a 21-day turnaround from the time you file to the time you receive your return. Now, you can calculate and submit your taxes whenever you want. The IRS just won't accept them and process them until the 24th. And from the 24th, that's when that 21-day clock begins. If you file a paper return, if your return has errors, or if the IRS doesn't have your correct direct deposit information, you're probably going to be waiting much longer. If you have health insurance and you need to purchase an at-home COVID-19 test, the federal government says your insurance company will now have to reimburse you. Of course, there are some limitations here. I'll explain those in a second and how this all works. But first, you may remember this video I did back in early December when the president made this announcement. At the time, lots of us were like, how's this really going to work? Well, today we got our answer. I'm going to talk about the uninsured in a second. But first, for those of you who do have health insurance, the order is coming from Health and Human Services and says, starting January 15th, if you have private health insurance or if you're covered by a group health plan, you can purchase up to 8 tests for every individual in your family covered under that insurance plan per month. Those tests must be over-the-counter COVID-19 diagnostic tests that are authorized, cleared, or approved by the FDA. So a family of 4 covered under the same health insurance can get up to 32 tests per month covered. You don't need a prescription to buy a test and get it covered, and there is no limit on the number of tests, including at-home tests, that are covered if ordered or administered by your doctor or medical clinic. Now, depending on your health insurance, you will either have to pick up one of these tests from a certain participating pharmacy where they would be free at the point of sale, or you would be able to buy them from anywhere, then submit your receipt, fill out a claim form, and get a reimbursement from your health insurance. Now, if your insurance has a participating pharmacy you need to use to get one of those free tests at the point of sale, and then you choose to go outside of that network, the government says you will still get up to $12 covered of the cost of that test. Bottom line here, every health insurance company is going to have its own program. So if you want to be reimbursed for tests purchased after January 15th, you need to check with your health insurance to see how their plan is going to work. As for those of you who have state Medicaid or children's health insurance, the government has already been requiring your COVID-19 testing to be covered without any cost sharing. Medicare pays for COVID-19 diagnostic tests performed by labs. And for those of you with no health insurance, Health and Human Services says 50 million free at-home tests will be distributed to community health centers and Medicare certified health clinics for distribution at no cost to you. HHS has also established more than 10,000 free community-based pharmacy testing sites around the country.